Well, it's really nice to be back here, and thank you, Michael. There's always a Philadelphia connection, I must say, even with some of our speakers. This is the disclosure of relevant relationships with industry, but I have to tell you, this presentation was not influenced by any of the companies that have supported me in the past. So, the topic, treating the upper face as a cosmetic unit with botulinum toxin A. There are many considerations to understand before you start treating the patient with any filler or botulinum toxin. And most importantly, we have to understand the patient's background, their race, their ethnic and cultural differences, because depending on their race, the bone structure and the muscle anatomy and skin thickness and whatever vary, they change. Not every patient is alike. Not every patient is the same. And also, men and women are different. We should not inadvertently masculinize women, and we should not feminize men in our treatments. To give you an example, women prefer a more arched eyebrow. Men are not bothered by crow's feet, so if they have them, they don't really care. So if you're going to look at the differences in the different races and the different genders of the patients that I just presented. In the upper face, in particular, it's easier to treat the entire area as one cosmetic unit because there are only 5 muscles that we have to worry about, and if you observe, all the muscles interdigitate with each other. It's extremely important that you understand the anatomy and how they function between each other, because your results will depend on your understanding of the anatomy and how the muscles contract. And if you look at someone's wrinkled face, in your mind you should try to understand that the wrinkles are perpendicular to the movement of the facial muscles. So if the facial muscles are vertical in attachment, the wrinkles will be horizontal. Not only that, there are sets of muscles in the face that elevate the skin of the face, and there are other muscles that depress the skin of the face. But in the forehead, it becomes very easy because there's one levator, the forehead muscle, and there are 4 depressor muscles. So if you look, when you examine a patient, think of the frontalis. Look and see where the muscle fibers are contracting, and you can understand that it's elevating the brow because the fibers are vertically oriented, and they insert in the galea aponeurotica superiorly, and inferiorly they insert in the skin of the brow, so they're pulling the brow up. And in some patients, there may be some empty space, a tendinous fascial sheath in the center of the eye, in the center of the forehead, but not always. And in the glabellar frown lines, there are 4 depressor muscles that lower and bring the brows to the center. They adduct the brow. The vertical lines of the frown lines of the center brow are caused by the corrugator supercilii, the horizontal fibers. I'm having trouble advancing, I'm sorry. And the orbicularis oculi, the orbital portion that are horizontal in direction. So those horizontal fibers are creating those vertical lines. And then the horizontal fibers that go across the root of the nose are caused by the procerus and the depressor supercilii. Now, also remember that there's this agonistic and antagonistic function of the levators and the depressors. So they sort of interact with each other, they are competition with each other, but with your injections, if you know where the muscles are and how they function, you can create a very nice result by the way you do your injections. And this is a patient relaxed, the same patient. So the other area of the face are the crow's feet, and they're in the lateral canthus, and they're usually produced when someone smiles. Again, it's the orbicularis oculi, but it's the lateral aspect this time of the orbital portion, and their fibers are vertical. When they move, there are dynamic wrinkles that are perpendicular to the muscle fibers, as we see, and they radiate away from the lateral canthus. However, there are some wrinkles that are always there, they're static, and they're caused by photo damage and chronological aging, which will not be influenced by botulinum toxin. Those are wrinkles that should be filled with a soft tissue filler. So it is really important that you assess the patient correctly pre-treatment. And so there are 4 points that are major and you should understand, and that is to determine the width and height of the forehead, identify the patterns of the glabellar frown lines, look for brow asymmetries, and observe the crow's feet different wrinkle patterns, because everybody is different and you must treat everybody differently. So let's look. Not every forehead is the same in the same dimension. Some are higher, some are lower, some are wider, some are more narrow. And these are the patterns that I use, that I inject. The units can vary according to the strength of the muscle, according to the sex of the patient, male or female. And what is more important is that you know how much muscle mass is there and how the muscle is functioning. So here's another before and after, a higher, wider brow. And again, a male has stronger forehead, especially if they work outdoors. And as you can see, after treatment, the depth of the wrinkle, this was in the summertime, is not tanned as the rest of the face. So it left the pattern, but the skin was absolutely flat. So the other area to understand is the pattern of glabellar frown lines. Not all frown lines are the same. And De Almeida Trinidad from Brazil did a beautiful study on identifying the different patterns, wrinkle patterns of the frown lines. As you can see, they have different names and not everybody is the same. And it's not because of their gender, because women also have different patterns. This is the U pattern, the omega pattern, but if you know how the muscles are contracting and you know the function of the muscles, depending on the patient, male or female, your injections will improve the wrinkling and you'll get a nice aesthetic appearance. But if you just do injections like you're injecting a picture in a book, you may not get the best results. So here's opposing lines, inverted omega, and look how nicely the results can be. And some of these patients can be a little difficult to treat. The other area that a lot of times we forget is look for brow asymmetries. Be aware of naturally asymmetric brows and patients who pluck unevenly, like this patient. She has a naturally asymmetric brow, and then she's kind of sloppy with her grooming. And then the other patient you have to be aware of are those that have permanent tattooed eyebrows. And basically, and I don't want to be pejorative, but women sometimes when they are making themselves up, if they're very busy, they don't look the same from one day to the next because, you know, the pencil may slip. So if this patient, you can see on the left, her eyebrow naturally goes up, and on the right it goes down. So you have to be aware of this and you have to make sure you understand this. So by doing your usual injection pattern, for this patient I had to put 4 extra units on the right and 1 to raise the depressor, and I had to put 1 extra unit on the left to depress the elevator. And as you can see, at rest and with smiling or trying to raise the eyebrow, the eyebrows are fairly symmetrical. When I do my injections, I want the patient to be able to move their brow so they don't look too stiff. So here's a patient where I had to drop the right side to make them even. Here's another patient that I had to weaken the depressors on the left side to raise the brow. And here's a patient I had to do combination, drop the right side and elevate the left side. So the patient had their treatment the way I showed you previously, but they had these extra units here and there to make the brow look evenly. So crow's feet are also different. Not all crow's feet are the same. You can have a series of 3 different types of crow's feet, or you can have another patient that their crow's feet start at the horizontal plane at the lateral canthus. So they don't need 3 injections. They don't need so many units. They need a certain amount of units to reduce the strength of that wrinkle, and they need only two points. Here's an example again The X stands for whatever you assess the patient, how much or how many units they need. Here's another patient, that's the same patient. Sometimes the same patient gets 3 on one side, 2 on another, not units, but points of injection. And here's a patient that I treated first with botulinum toxin, and then a month later did CO2 laser resurfacing, and I took 30 years off her face. Combination treatment. And now, in the States, Allergan has recently got FDA approval for forehead treatments with onabotulinum toxin. They already had the crow's feet, and originally they had the glabella. Someone comes into the office, there are 16 sites that are at least on label. We can treat these patients without being concerned about if we're treating them off label. And according to the studies, calculated 64 units that will give you an effect. I hope I have everyone understand that the magic number is not 64 units. It could be 30, it could be 75 units. It depends on your assessment of the patient, the muscle strength, and the patient themselves, their ethnic background, and the shape of their face will determine how many units you need to inject in the upper face to create a one cosmetic unit treatment. So in conclusion, know the functional facial anatomy, understand ethnic differences, preserve gender aesthetics, follow fashion trends, because sometimes you want higher eyebrows, lower whatever. Treat each patient individually. This is the most important message I want to give you today. And then maintain good judgment. Understand what the patient wants and try to create what they're looking for. So thank you. So I do want to announce, and I hope it's okay, that the third edition of Botulinum Toxin in Clinical Aesthetic Practice is now available. And tomorrow there's a book signing at Wise Press booth. It's R10 at 10:30 during the coffee break. Thank you again.